So we're going to be going over our next video lab about the axial skeleton. First off, let's start with some of the bones of the cranium. So we have our frontal or our parietal bones on either side. Oops, going out of focus. So also on the back, we have our occipital. There we go. Our occipital. This point right here, that is our external occipital protuberance, and muscles attach here that allow the head to tilt backwards, and that's where they attach. On the sides, we have our temporal bones. So here we have our temporal mandibular joint, which is right there. Right behind it, we have the mastoid process. The styloid process would protrude down from here in a pointing process, but it's not shown. The external acoustic meatus, one second, that's right there. And the squamous part of the temporal bone would just be along the top portion. Let's switch to an internal view. The petrous part of the temporal bones are these raised sections here and here. Inside of those are the main portions or organs for hearing. And the internal acoustic meatus, let's see, one second, be right around there, and it would connect to the external. Okay, so we're going to continue with the sphenoid bone. That's going to be located right around there. The greater wing can actually be seen through the orbital socket, and it will go protrude outwards. The internal view will give you a much better view of it. But next we're going to talk about the superior orbital fissure. Those are going to be here and here on either side. Nerves are going to pass through there. Speaking about the greater wings again, they're going to be following those curves here and here. Right above those, we're going to have the lesser wings following those curves again here and here. Next up, the optic canals are going to be here and here, and the optic nerves are going to pass through there. The sella turcica is going to be right there, and the pituitary gland is going to sit in there. The last part of the cranial bones we're going to talk about is the ethmoid bone. Seen from the top, it is these front right here, and in the center, that protrusion, that is the crystal galli. The crystal galli is where the dura mater attaches. It helps keep the brain pretty much in place. On either side of that, that's going to be the cribriform plate. And small unmyelinated axons are going to pass through that. Alright, next we're going to go over the different sutures that connect the bones in the cranium. So first off, running side to side, That's your coronal suture, and that's going to connect your frontal and parietal bones. Next is the sagittal suture. That's this one. Right here. And it's going to continue back. And the sagittal sutures is going to connect both sides of or both left and right parietal. In the back, we have the lambdoid suture. Here we go. See that there? That's lambdoid suture. And that's going to connect the parietal and occipital bones. And right around here, which is kind of blocked off by the separation of the skull, that's going to be sorry, the squamous suture, and that's going to connect the temporal squama with the lower border of the parietal. Alright, so next off we're going to be talking about the facial bones. First we have maxillary. It's going to be, get into focus, well, it's right here. Then you have the alveolar process, which is right above the teeth, and it's what's going to hold the teeth in place. After that, we have the nasal bone. It's just going to be right here. Then we have the zygomatic bone, which is right here. And then this is the zygomatic arch. And that is composed of the zygomatic process and the temporal process. The ethmoid bone we saw earlier, but it can also be seen from the front, from the nose, in the nose, and medially in the eye, or the orbital sockets. The volar bone is right in here, in the bottom side. And the two bones that make up the bony nasal septum are the ethmoid vertical lamina and the volar bones. The inferior nasal concha is inside of the nose, deeper on either side, and what that's going to do is warm and moisten the air. Alright, so next we're going to go over the parts of the mandible. Let's see. So we have the body, the angle, which is here as it turns, the ramus or ramus, which is this main portion, the mandibular condyle, which is back here, mandible. We have the mandibular notch, which is that curve right there, and the coronoid process, which is that up in there. And that wraps up our facial bones. Next, we are going to be going over the vertebral column. The four curves of an adult vertebral column are the cervical curve, here, the thoracic curve, here, the lumbar curve, which is here, and the sacral curve, which is down here. The two primary curves are the thoracic and the sacral, so here and here. The two secondary are the cervical here and the lumbar here. So really quick, we're going to wrap up the last of the vertebrae. The lumbar vertebrae consists of 5 different individual vertebrae, and the sacrum is also made up of 5 fused vertebrae. One structure we need to point out is the coccyx, which is, turn it around, this right here. And that's going to wrap up our vertebral column. So next we're going to be talking about the cervical vertebrae. There are 8 of them. One thing we want to point out is the first vertebrae is the atlas. And this vertebrae is what enables the head to move in a nodding motion and as well as a rotational motion. The atlas articulates with the axis. One unique feature about the transverse processes of all the cervical vertebrae is that they allow for passage of the vertebral arteries and veins as well as nerves. Okay, next we're going to be talking about the thoracic vertebrae. There are 12 of them. First, we're going to show you the spinous process, which are any of these. Next, transverse process, which are on the back, which are the left and right protrusions on all of the vertebrae. Next is the intervertebral foramen, which is going to be hard to see, but it's going to be the gap between the vertebrae, like that, there, or that. The spinal nerves, dorsal root ganglion, arteries, and veins pass through those. Okay, so the body of the vertebrae is going to be any of the main sections, like such as here and wrapping around. Next, the intervertebral discs are actually going to be between each vertebrae. So between each one, there's going to be an intercalated disc. And that's it for the thoracic vertebrae. So the next portion we're going to talk about is the sternum. Right up top right here, that's the manubrium. Going down, the rest of that in the center, that's just going to be the body of the sternum. The xiphoid process is going to be this pointy bit at the end, the one they're always cautioning people about when performing CPR. And this groove up on top, right here, that's going to be the jugular notch. The next portion we're going to be moving into is the ribs. First, I'd like to point out which ones are the true ribs, the false ribs, and the floating ribs. The true ribs are these ribs, which are directly connected to the sternum. The false ribs are these, which are not directly connected to the sternum. And the floating ribs are these ribs down here, which are not connected to the sternum at all. So we're going to go over the different portions of a rib. So the head of a rib is the closest point to attachment with the vertebrae. Right next to that is going to be the neck. And right under it, towards the bottom portion of the rib, excuse me, that's going to be the tubercle. Ribs attached to the vertebrae Well, the head of the rib attaches to the demifacet, and the tubercle attaches with the costal facet. And that wraps up our video lab of the axial skeleton.